I remember it was irrigation season because I have a small farm in New Mexico where I have some horses and cattle, and of all things I was spreading fertilizer before we irrigated, and started having kind of a pain in my shoulder, which didn't seem like much. I have a little man cave out at my farm. Went up to the man cave, got a couple aspirin, went back out, drove my tractor some more fertilizing, and didn't get any better. So I called my doctor, Dr. Ed Wattis, told him what was going on, and he said, well, could be maybe a heart attack, maybe not, but why don't you go over to see Dr. Calderoni, who is a good friend of mine also. Went over there, and Dr. Calderoni said, I hate to tell you this, Jim, but you're having a heart attack.
We think about cancer being a significant health problem, but the number one killer in the United States and globally is cardiovascular disease. More people will die of heart disease in the United States than any other disease.
So cardiovascular medicine is a broad spectrum, covers diseases of the heart and also blood vessels. When we think of cardiology, we just think we focus on the heart, but we take care of blockages in the legs, we take care of blockages in the arms, sometimes in the kidneys, sometimes in the mesenteric arteries. So it is taking care of not just the heart, but the entire vascular tree.
I thought a heart attack, it was like on Sanford and Sons, you know, this is the big one, Lucille, whatever his wife's name was. But all I had was just an ache in the shoulders, which I'm glad I didn't blow it off. You know, I was supposed to go to Ruidoso that afternoon, but luckily I did call Dr. Wattis, and luckily he sent me off to have it taken care of.
Jim's doctors transported him to University Medical Center of El Paso, where a cardiovascular team was already waiting for him.
20 or 30 years ago, the treatment of a heart attack was really very different. You put someone in a hospital and you hope they did well and they stayed hospitalized for 6 weeks. But now, because of new technology and new advances, we actually have the ability to open an artery up to restore blood flow. And if that's done quickly, you can minimize the heart damage, and that's exactly what was done here.
What is called a code heart, which means that mobilizes the cath lab, the interventional cardiologist, and a number of nurses to go pick up the patient from the emergency room, bring them emergently to the cath lab, and the goal is to open up the blocked heart blood vessel as soon as possible, but certainly within 90 minutes, because beyond that, the myocardial salvage is incomplete. The earlier we can open up the blockage, the more chances we are going to save heart muscle.
And 31 minutes later, I had a heart stent in, and everything turned out great.
Now, ultimately recovered very well, but it was because of the expertise and the excellent care that he received there that he made a full and complete recovery. And so I'm happy to say that Jim Volk now is leading a very active and healthy life, and more importantly, contributing to the medical community because of his role on the board of managers at UMC.
You know, I didn't realize how I guess, modern our hospital is. Yeah. And if you really take a tour of the hospital, we're very, very modern, very, very dedicated staff, and I'd put it up against any hospital in the city.
The credit goes to the emergency room, our excellent team of interventional cardiologists, which includes Dr. Siddiqui, Dr. Oja, Dr. Nagaraja Rao, Dr. Carr, and myself who do these procedures, but it's everybody working together. It's a team, the CCU nurses, the cath lab team working together to make this happen and take care of our patients in the community.
University Medical Center of El Paso is an accredited chest pain center by the American College of Cardiology. UMC offers a cardiac catheterization lab, a dedicated operating room suite for cardiovascular care, and a cardiovascular fellowship program.
Which is unique. We're the only hospital which has cardiovascular training in the community and in this area. So in addition to trained interventional cardiologists, we also have cardiovascular fellows 24/7 available to take care of the sick patients.
UMC of El Paso always has a cardiologist available to take care of any patient having a heart attack. Today, Jim Volk is an active banker, community leader, horseman, rancher, husband, father, grandfather, and friend. So be sure to follow Jim Volk's advice.
If you have an aching shoulder, don't blow it off.